Fractured Clavicle, a webinar by Natalia Laufer. First, let's review just what a fracture is. A fracture is a broken bone. The severity of a fracture can range from a thin crack to a complete break. The clavicle, a long bone of the chest, is affected by a clavicular fracture. The bones, left and right, commonly referred to as the collarbones, lie horizontally and have three main functions: attachment via the shoulder girdle, protection of the nervous innervation of the chest, and transmission of upper skeletal movement. The clavicle is part of the appendicular skeleton. Though the fracture itself is of the bone, the surrounding muscles and ligaments can easily be affected during the break. These muscles include the deltoid, the trapezius, the subclavius, the sternocleidomastoid, the sternohyoid, and the pectoralis major. The possibly affected ligaments include the coinoid ligament and the trapezoid ligament. The fracture itself isn't uncommon, accounting for roughly 5% of adult fractures. The clavicle can crack or break in a number of ways, most of which occur when the shoulder receives trauma from a fall that puts too much pressure on the clavicle, causing it to snap or break. Other possible causes include sports-related injury or vehicle trauma. A clavicular fracture is also a very common birth injury due to the pressure exerted on the shoulders during delivery. A fractured clavicle can also occur without trauma via weak bones or illness. In the GIF, we have a hockey player. Oh, sorry, the GIF isn't working, but in this GIF, we have a hockey player who gets checked by his opponent and falls to the floor directly on his shoulder, which inevitably causes too much pressure on the clavicle, causing it to snap or break. Sorry, not sure why that isn't working right now. Complications with a clavicular fracture are rare, and most injuries heal without difficulty. However, some complications can arise. Nerve or blood vessel injuries, signaled by the numbness of the arm, are possible as the clavicle lies above several important nerves and blood vessels, as seen in the picture below. Poor or delayed healing can lead to the shortening of the bone, and occasionally a bump can occur at the site of the fracture visible through the skin, but this usually disappears with time. Lastly, if the fracture damages the joints surrounding it, it can increase the risk of arthritis over time. The treatment for a broken collarbone involves the use of a sling or figure-of-8 splint to keep the area mobile for 4 to 8 weeks. The immobility of the shoulder is to continue until the limb can be moved without pain. To soothe pain caused by the fracture, an over-the-counter or prescribed medication is used, to the doctor's discretion. In most cases, the clavicle heals without complication, but for about 5 to 10% of breaks, surgical intervention might be required. Surgery is only required for one of the following reasons: multiple fractures in one clavicle, open fracture of the clavicle, meaning it pierces through the skin, clavicular shortening, damage to the underlying nerves and blood vessels, or the failure of the bone to fuse. Therapeutic exercises can aid in the rehabilitation of the affected area after a clavicular fracture. These exercises include, but are not limited to, the shoulder blade squeeze, where you move your shoulders towards the midline, wall angles, where you move your arms in an upwards position, shoulder flexion, and chest stretch. These are all my sources. And that's all, folks.